Well, welcome. I'm Mark Chataway. I'll be moderating the webinar today. Thank you very much for joining us. It promises to be a fascinating session. Sara has some great slides for us, which will give us a flavor of the research that she's been doing. If you're new to Christian Connections for International Health, it's an international network of about 115 Christian organizations, 15 secular partners, and a few hundred individual members. CCIH's mission is to promote health and wellness from a Christian perspective, and there are opportunities for capacity building, networking, sharing of best practices, and advocacy. So let me talk you through the flow of the webinar today, if I may. We'll hear briefly from Sara and from Chizoba, who I'll introduce in a second, and then we'll have lots of time for questions and comments from you. So what I really hope is you'll have questions, and you may also want to put into the chat box there your experiences, if they're different from or add to those you're hearing about. The webinar is being recorded, so if you don't want us to mention who you are, tell us, because it's being recorded and it will be posted on the CCIH YouTube channel and on the CCIH website at ccih.org under resources and infectious diseases. There's a lot, by the way, in that section on infectious diseases as a whole and on COVID-19, and it'll be cross-posted in the immunization section, and there's even more there. So if you're registered today, you'll get an email with the link to the recording. So let me introduce myself, if I may. I run two consultancy businesses, a very subtle branding on the wall here behind me, based in Ireland and Wales with partners around the world. And we work on health policy and research, on stakeholder strategies and communications programs. And one of our companies, Hyderus, is an associate, a CCIH affiliate. So most of our work is for a combination of pharmaceutical companies, international organizations such as Gavi, and universities. And we've had the privilege of working with lots of faith-based groups, including the Cameroon Baptist Convention and the Christian Health Association of Kenya and the Christian Social Services Commission of Tanzania. Sara Melillo, who you'll hear from in just a minute, is an MPH. She's got 15 years of experience as a global health technical and program development professional. She was based in Kenya for 3 years. She's currently an independent global health technical consultant, supporting program design and assessment. You can see all of the details on the slide that's on your screen right now. And you can see that she's been with a number of faith-based organizations, including the Catholic Medical Missions Board, IMA World Health, and the Joint Learning Initiative. So that's Sara. I'll give you a couple of seconds to just have a quick look at Sara's bio there. Chizoba Wonodi is also joining us from Johns Hopkins. I'll give you a full introduction to Chizoba a bit later on when she gives us the reaction to the slides that Sara is going to present. So Sara, this landscape analysis, I realize asking you to compress it all into 15 minutes is an almost impossible task, but you're going to give us a flavor of the work you did and the findings of the study, right?
Thanks, Mark. Yeah, that's exactly, you beat me to it. I was just going to thank everyone for their patience as we move through this fairly quickly. I'm a bit of a fast talker, so I apologize if I move quickly, and stay patient, but hopefully the slides will give you some text to look at. And I did just want to note that these slides will, they're pending review and approval, but they will be available, the full study, on the USAID Momentum website and the CCIH website. So please stay tuned for that. And in the meantime, I encourage you to check out the CCIH immunization portion of the website for the recording of this session. So thanks everyone for your attention today. I'm going to speak through some of the key headlines from the study, and really we want to spend a lot of time engaged in dialogue today and questions, because that's really what's most interesting, your experiences living with this, through this. So I worked under the USAID Momentum Country and Global Leadership Project to conduct a global landscape with CCIH on the effects of faith actor engagement in the uptake and coverage of immunization in low and middle income countries. So that's quite a mouthful, but we're really looking at we all know that faith communities play such an influential role in, all aspects of many people's lives. And, what role do they play in promoting immunization, both positive, neutral, negative, like many communities? So this was kind of a literature review and key informant interviews, an attempt to really document and capture that. Very timely, as we all know. You've seen, you're living through COVID-19 vaccination and other pieces, but it's great to be here with all of you. Next slide. So here's a little bit of a glib quote, but I think one that really kind of captures, why did we take a look at this? We know that faith leaders play an influential role in immunization. There have been some really public cases of really noted vaccine hesitancy in some countries that have gotten a lot of news media coverage, a lot of global health coverage, unfortunately negative. And we know, again, that there is vaccine hesitancy, in all communities, not just faith communities. I want to say that very clearly. This was a look at faith communities to tease it out and learn, how can we work more effectively with faith communities to promote vaccine information. But here you see a key informant talking about sort of the acute dangers, right? From our perspective, polio, one of these examples I talked about, showed that one word from a religious leader just upset the apple cart. You had another 10 years fighting polio and billions of dollars spent. So these have real life impacts on our programming. There is a limited understanding of how faith actors impact the uptake and coverage of immunization. We found that in our lit review, which we're going to talk about. Secondly, vaccine hesitancy is rising in low and middle income countries, including within faith communities. I would also note the topic of the study was not high income countries, but it is also rising in high income countries. And finally, this study is helping inform us for the future, including COVID-19 vaccination, which is very much in everyone's mind. But just to be clear, this study was looking at routine immunization and campaign-based immunization. We did have some COVID-19 vaccination resources explored, and we'll talk a little bit about that, including in our dialogue, but it was much broader than COVID-19. Next slide. So the global landscape analysis had 3 questions, which you can see on your screen here. How do religious leaders and faith-based organizations impact the uptake and coverage of immunizations, including roles in vaccine hesitancy? What successful strategies exist to work with faith actors and communities to improve immunization acceptance and reduce hesitancy? And this is a real focus of our work now, which I'll talk about later, right? How can we gel some of the best of the work, which actually, looking through the participant list, there's a number of you who are engaged in really great work, who I'd love you to bring some examples up later. And finally, what evidence gaps exist in relation to faith engagement and immunization? This was a literature review of the past 10 years of 110 resources and 18 key informant interviews. So there's a lot. Next slide. Before we dive into the headlines and the interesting parts, I did just want to take a pit stop on that evidence for those who are really interested. And again, there'll be a lot more in the full study that'll be online. But in general, you can see in this table that vaccine hesitancy as an actual topic was more popular than just the general faith engagement in vaccines. That makes sense, right? We're focusing on challenges often in research and literature. And they were often focused on campaign-based vaccinations, such as polio, other pieces, and hot button issues, rather than routine childhood immunization. The good news is that a lot of the research is increasing. In the past 5 years, there's been quite an increase in articles. And I just did want to note that this landscape didn't look at sort of news media and pop culture, which we all know, right, is quite prominent. This was looking at some of the kind of published peer-reviewed literature as well as gray literature. Geographically, you can see that there were a few countries that were really focused on that came up a lot. The most popular countries in the study were Nigeria, Pakistan, Malaysia, Kenya, and Zimbabwe. So that was really exciting, but there were geographic gaps in Latin America, the Caribbean, North Africa, Asia. So you can see, people kind of focused on a few areas. There were a lot of articles focused on polio vaccine hesitancy amongst Muslim populations. And again, I just want to say, while researchers may have looked at these issues, that is not to say that Islam or faith communities are the drivers or main purveyors of vaccine hesitancy, by no means. And that came out quite clearly in the research. Though some of other faith communities were understudied, there were certainly a lot of examples. Next slide. So what did we learn? What are our top 3 headlines here? Well, breaking news, this will probably come to no surprise for our participants who have a lot of experience with this, but the evidence did show it is important to engage faith leaders to promote immunization in low and middle income countries. It was quite clear that there is a defined impact that you can measure. But unfortunately, we're not quite sure what works best in which context. So I see a lot of public health practitioners and anthropologists and others who are on the call today. And we all know things are local, 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 right? And the same holds true there. There weren't really many intervention studies or evaluations of what really works in which context. There were some common promising practices that I will talk through, but certainly we have some gaps in what works best in specific areas. Secondly, listening and dialogue with faith leaders is critical to finding theologically acceptable solutions to vaccine hesitancy, right? Meeting people where they are. This doesn't necessarily apply just to faith leaders, so it is quite important, right? There's some religious texts and some doctrine that sort of guides messaging and other pieces. I'll say, you know, my own personal experience with COVID-19 vaccination, my own mother is hesitant, and it's been frustrating, right? And I can read this slide, and listening and dialogue is important, but I'm failing personally. So I think this is a lesson for all of us, right? How can we find entry points, ways to work with people? Finally, COVID-19 is elevating the urgency of this work. This is a little bit of a misnomer here, and Chizoba is going to talk about some of her exciting research, but some vaccine hesitancy is actually being exported from the West to faith communities and non-faith communities via YouTube and really convenient videos that are packaged quite well and social media. So we're just really quite worried about this impacting the rollout of the vaccine. Next slide. Other pieces that I thought were kind of important, and I would love to engage in dialogue with you all about these, is, you know, it's hard to tell with that if vaccine hesitancy stems solely from theology and religious, you know, underpinnings, or if it's a convenient cover for more complex and interrelated topics, socio-cultural and political issues, right? Is it a proxy, right, for something else? Is it impacted by social norms? All of this is interrelated. And I think for our researchers who are on the call, you know, it's really hard to control for specific variables. So hesitancy is a complex topic. And I think a lot of our case studies and examples will kind of show how different pieces play through. There are colonialism effects on health systems that, you know, impact whether people want to seek services, perceptions of health interventions by them. So we know a lot about polio vaccine hesitancy around predominantly Muslim communities. I mentioned that earlier again. This is again to say that it's been well studied, but certainly not representative of all the vaccine hesitancy around. And also supporting supplementary immunization campaigns, right? I mentioned that sort of campaign-based outreach, a little less so on routine immunization. 40% of the studies focused on Islam, 15% on Christianity, as I kind of mentioned before. And there was very little on, as you can see, a number of faiths, right? Growing Pentecostal and charismatic faiths in Africa, Buddhist and Hindu faiths in Asia. So those are definite gaps sort of in our learning and knowledge, though we do have some practice-based knowledge. As you can see, you know, finally, a lot of the great learning lies within the experts themselves, within communities, and doesn't always make it to write these international journals that folks don't have access to. So we really were trying to capture some of that in this exercise, and CCIH will be working more in the future to capture that as well. But there's some great FBOs doing wonderful work on immunization as well as other areas. Next slide. So some big picture trends, and again, these are really 30,000 feet or meters for those of us in countries using meters on vaccine hesitancy in faith communities. Religious factors are the third most frequently cited reason for vaccine hesitancy globally. And this is after a couple other factors, including, accuracy and trust in vaccines. So again, that is validating, right? We know that there are some historical and current linkages to religious influencers impacting immunization, though few religious groups' official religious texts explicitly reject immunization. Actually, looking through, and we're not going to cover that today, I actually looked through some of the mainline religions to see not personally, I looked at other scholars' interpretations of some of the texts to see what they really said. And interestingly enough, this takes us way back to 1000 AD with Buddhist nuns who apparently were scraping the variola, the sort of scabs of people with smallpox, and grounding them up in a mortal and pestilent, blowing them in a tube into the nose of uninfected people to prevent them. So we actually see religious vaccination way back earlier than some of our most prominent examples, and there's some great art. Views about vaccines vary within a religious group. That's not a huge surprise, but just there is such religious diversity no population is a monolith. So again, when you're designing interventions, when you're trying to tackle hesitancy, it's convenient to put folks in a box, you are XYZ Christian faith, but there is a lot more complexity geographically within subsects, other pieces. Studies show recently that vaccine hesitancy has been rising in some predominantly Muslim countries. That's not a universal. There's certainly a number of countries that are not where it's not rising, including Saudi Arabia and Bangladesh. But I just did want to note that it is one recent trend. Again, there wasn't a lot of literature on other faiths, so it's hard to say how much it's rising in other places. And there was actually some interesting findings around mixed religious environments. Before we move on, I think it's interesting to learn that the major concerns about vaccine hesitancy across all religions, and isn't that quite a big group, is kind of four key pieces. One is that humans shouldn't override God's will with man-made solution, the sort of let nature take its course, and you find that across, in different wording, but idea-wise across a number of faiths. God created a perfect world and in it a perfect immune system. I wish I had a perfect immune system, but it's a wonderful belief, and you do see it across different religions. One that we are all pretty familiar with, especially with the Catholic Church in the news, is violations against taking life and the interpretation and use, the very complicated use of fetal cells within vaccination. This is not just amongst the Catholic faith. This violation amongst taking life is actually seen in the Jain religion, Buddhism, other pieces. So that is a common kind of theme across. And finally, violations of different dietary laws and religious laws, porcine and bovine, pigs and cows and their use in vaccines, seen in Islam as well as Judaism and other religions. So those are kind of the common pieces, but it really does vary, as I said, within a different group. Next slide. So I just want to stop for a minute, and I think we'll have more dialogue here probably around COVID-19 vaccination and share. You can see on the screen some of these great key informant interviews, and the 18 key informants, some of whom I think are on the call today, just were very generous in sharing their insights around COVID-19 vaccination and a range of other topics. I did want to call out, in terms of COVID-19 vaccination, that World Vision is doing really excellent work in research around COVID-19 vaccination. They did a 6-country study to guide, prepare for COVID-19 vaccine rollout that you can see on their website. And they're rolling out Channels of Hope in a couple countries, which is one of their methodologies for working with faith leaders. So I did want to point folks there because they're doing some good work. Again, we've seen vaccine hesitancy for COVID-19 vaccine in a number of countries. India and Kenya have come into the news, at least over here, quite prominently, with some hesitancy around healthcare workers as well. I do think it is a bit, I just want to throw this out here. I'm editorializing. This is not the views of CCIH or USAID, but just it is a little hard to talk about hesitancy in low and middle income countries without access to vaccines, because we know there are a lot of people desperate for vaccines and very willing to take them. So this is looking and trying to prevent, working with this subsection of folks who will be hesitant everywhere, as we've seen in high income countries. But I did want to flag that. And my colleague, Dr. Wonodi, will talk about some of her work, maybe in really interesting work in Nigeria around COVID-19 vaccination. And finally, before we move to the I did want to talk that you all and many national faith communities and global faith communities have been at the forefront for calls on vaccine equity for COVID-19. So faith communities are really working and trying to advocate for folks' access, which is really important. Next slide. So before we wrap up and I move to my colleague, I just wanted to talk about a little bit around, and here we are, what I just spoke about. Next slide. I wanted to talk about what we know works. I mentioned this at the beginning, right? It's not all doom and gloom. We have some research around what works to engage faith communities successfully. Most interventions that we looked at did involve religious leaders and local communities and dialogue-based interventions around really going back and forth, promoting the vaccine, sharing transparent information. So a lot of social and behavioral change and kind of dialogue approaches. And I think the quote at the bottom is a lovely sentiment that one of our key informants shared. And I think some of our faith-based organization colleagues can really identify with this. There's a lot of generalized talk about wouldn't it be great to have faith actors involved in immunization, which it would be great, and we do, but there's not much that's really useful about how we engage faith communities as partners, right? And that's part of this work, is trying to figure out what does work for mutual accountability, for mutual work in this area. Next slide. Other things that we found worked based on evidence and key informant is including engagement of faith actors as part of a multi-pronged strategy, right? This includes targeting different populations or identifying who you want to work with and ensuring the availability of the vaccine, right? Supply and demand, those kinds of pieces. There's other aspects of part of the multi-pronged strategy, but just noting, messaging alone is unlikely to be super successful. The second point being the use of religious structures, faith-based health facilities, and religious rituals and practices are quite effective. There was a really great example of within Nigeria associating infant vaccination with a 7-day-year-old baby naming ceremony. So working with religious leaders to kind of build in, right, this ritual, this is something that happens always, building in messaging and actual delivery of the vaccine. Engaging faith-based organizations and faith communities was shown to be very important for new vaccines, such as COVID-19, but also a variety of, HPV, rotavirus, pneumonia, vaccines that were newer. Addressing religious concerns to vaccines through theological analyses, dialogue, and sensitivity, and helping folks understand the alternatives. So I think that alternative is really interesting, right? If there's a specific objection religiously to potentially some materials in a vaccine, is there another alternate vaccine that could be used, another approach? Engaging in theological dialogue, and this is not to say when a lot of nonprofit organizations, international groups may come and sort of say, here's a slide with your scripture and let's look at it, and this is why it says vaccines are okay. That's not effective. I mean, it could be effective, but it's not. It's actually having a dialogue with those religious leaders, working through, finding those, parsing them out, and coming to that conclusion, right? Just because someone tells you something is okay for you, that doesn't mean that it resonates with you. And then, of course, with Muslim populations who may have a concern about the halal status of vaccines, that's a very important point, very important theme. That is important to address directly in areas where that is a concern with faith leaders. And there are some wonderful examples of Muslim faith leaders issuing fatwas, promoting vaccines, talking about permissibility and other pieces. Next slide. So I'm not going to read all of these quotes on the page, but one thing that came out really clearly, as we said, was the importance of listening, right? I think one of the great ones on the bottom right is Someone said, one mistake I will never make again is to give a rational response to an irrational fear. And I think that's one of the important takeaways, right? That you can't just science your way out of this. I tried it with my own mom, does not work. I'll tell you right away. And she's a believer in science, right? You can't just hit the nail with whatever hammer you have. You really need to listen, and you need to find an entry point to address fears about vaccines, which, as another key informant pointed out, are very real, especially for new vaccines. It is legitimate. One would have kind of hesitancy and reluctance with something new. That is not unusual. That's quite normal. So validating that fear and being transparent. Next slide. So some of the more specific promising practices that our key informants shared and the literature showed was using a top-down approach when appropriate with religious leaders in hierarchically organized religions, such as Cambodia, which has a well-established set of pagodas that are used hierarchically to kind of train different religious leaders. Northern Nigeria, in terms of some of the Muslim faith leaders and structures. Now, this is not the case in many places, right? We talked about local, but in areas where it is hierarchically organized, it can be a convenient way and a respectful way to work through the current structures. Similarly, it may be appropriate to look at working with interreligious organizations, such as Religions of Peace. A number of countries have interfaith councils. Sometimes this is appropriate, right, to come together and in a coalition supporting vaccine, whereas other times it may not be the right entry point. If there's a specific faith that might have hesitancy, you might want to work just with that faith to avoid, some of the political issues and other things. This is often the tendency, honestly, for folks implementing international programs. It's a convenient platform, right? Oh, I go straight here, I get everybody, I have all the religions covered. And that's not just for immunization, it's for a number of topics, but it really is context specific. It's important to break down the clear scientific information on the safety of and efficacy of vaccines. Of course, this is for really any health intervention, but making it digestible. The science can be very complex and folks are sophisticated, right? Just online, there are so many, everybody, I think Dr. Wonodi told me at one point in a conversation that like everyone is a vaccine expert, right? People have access to a lot of information about vaccines online. And it makes it, people are sophisticated. So it's really, there's a lot of information on there. So speak to people where they are. Religious leaders, and again, we're not assuming that religious leaders or anyone is ignorant on vaccine or health issues, right? Religious leaders are serving, many of them, especially in faith-based health facilities, are serving their clients at all times on health issues, and are doctors themselves, nurses, they're quite mature. And finally, be honest when the vaccine science is evolving and there's open-ended questions remaining, right? Science, there are some questions, and it's better to be honest and say, this is what we know, this is what we don't know, to engender trust. And I think I talked a little bit earlier about working, with religious rituals and practices, using Friday prayer meetings, potentially women's groups for religious groups, working with barbers or places where men gather. Next slide. And I think I touched on a few of these promising practices earlier, but just using religious scholars to look at texts and use religious-driven argumentation. I thought it was really interesting. Someone pointed out, and I hadn't thought of this, is tapping into health workers who are members of faith congregations, right? They are respected. They can play a leadership role in immunization messaging and building on their esteem and trust in the community. Someone noted that working with global faith leaders on governance and accountability is important to make sure, some religious faiths are very diffuse. They're globally, worldwide there. So within a country, they may deviate from maybe what the mainstream religion is promoting or saying about vaccines. So making sure there's common messaging and accountability if this is a deviation. I think we've seen this a little bit recently in Kenya with some confusion around the Kenyan Catholic Doctors Association versus what, the Vatican was saying about the vaccine. So just kind of being on the same page. And finally, partnering with faith entities over a period of time. When we see what has gone well with faith communities, it goes well when things move slowly, right? This is especially with emotionally weighted topics or things like vaccine hesitancy, that the sort of parachute in, parachute out approach is not going to be effective. Next slide. I did just want to point out before we move to our next speaker that there are some really great information sources if you're interested in immunization and religion, not just vaccine hesitancy, but including it. You can see here Berkeley Center's Religion and Immunization Resources, wonderful work, really dialoguing a lot too around COVID-19 vaccination. CCIH, of course, the host of this webinar, the Joint Learning Initiative as well has done some seminal work on this issue, and a few other resources there. Next slide. So I just wanted to say thank you for listening, and my colleague, Dr. Wonodi and Mark are going to take it from here.
Thanks, Sarah. That was a really fascinating presentation. Just before we come to Chizoba, I want to take two quick clarification questions. Jeremy Cook asked about KII. So I think, and someone kindly responded and said key informant interviews. I think it's important to say these key informant interviews are experts who can help shed light on the review you've done, right? Is that a good way to characterize them?
Correct. These are folks who have been involved at a global, regional, and national level on immunization issues and working with faith leaders.
Great, thank you. And then Moai Makoka said, was the lack of understanding of the basic biology of vaccines contributing to misunderstanding and hesitancy? So I know that's a big question, but did it come up a lot that if people knew a bit more about the biology of how an inactivated vaccine works, for example, that was reassuring?
Yes, and so it's a great question, and the landscape was global, so there were certainly some articles did cover that. I would say that came up as one theme. In some cases, when you're doing your kind of diagnostics, if that is sort of a fear, walking through that, making it digestible, understanding was quite helpful. Yes, but I can't pull out a specific example. I wouldn't say it was the major number one driving fear and hesitancy amongst every community, right, studied across it, but it was an important one. And it does tie, I think, as well to some global vaccine hesitancy, non-faith fears, right? Just what's in this thing that is being injected into me.
And I have to say, I mean, when I went to get my COVID vaccine, the very nice nurse who gave me my COVID vaccine, she was actually a midwife. Apparently, people in Europe have decided not to have children during the COVID epidemic because they don't want to end up in hospital, which is reasonable, I guess. So they've deployed the midwives to give injections. So she was a midwife. But she was great. She said to me, here's the injection. She said, it doesn't have any live vaccine, so it can't possibly cause COVID, which I knew. And she said, and if you feel a bit under the weather tomorrow, that's a great sign because it means your immune system's working and it's recognized it and it's defending itself. And I just thought, okay, it took her 20 seconds, but it was a really reassuring thing to say. With that, let's go on to Chizoba Wonodi, who's the Director for Immunization at the 5-year USAID-funded Momentum Country and Global Leadership. She's an associate scientist at the Johns Hopkins Bloomberg School of Public Health. Again, you can see her full and very impressive biography on the slide online. Chizoba, I'm going to ask you, given this global experience and the research you've done yourself in Nigeria, to reflect a little bit on the slides we've seen and to tell us a bit about that research you've done.
Okay, thank you so much, Mark and Sarah. Excuse me. Good morning, everybody. Good afternoon. I'd like to say thank you to CCIH for a fantastic job on this and for inviting me to this forum. Sarah, when you were speaking, I was just nodding my head and I said that the findings from this, your landscape analysis, they ring so true. And they couldn't be more timely, especially now that we know that there's a huge effort to push out the COVID vaccines. And I think just a couple of days ago, I was listening to an NPR. There was an NPR program looking at the COVID vaccine rollouts in the United Kingdom and Israel. And one thing they said was that these two countries, they've had tremendous success in vaccinating a huge swath of their population. And one thing that news item talked about was the fact that the program actually was intentional in going to religious leaders to address hesitancy, in advance. So we're seeing that this attention to the role that religious leaders can play in vaccination is expanding beyond lower middle income countries. So you even have that in Israel and in UK, they recognize that influence that religious leaders have. And that's very true. I mean, you can see that, you can see why that is so. In Nigeria, for example, majority of people identify themselves as religious. We have a study that is just rounding up in Nigeria, funded by the Wellcome Trust. And we're looking at vaccine hesitancy. And one of the questions we ask people is whether or not they are religious. 99% of the respondents were either Christians or Muslims. So that means that majority of people have a connection to a faith-based leader that they consider important in their lives, in shaping their opinion, perhaps shaping their behaviors. So if immunization is such an integral part of the fabrics of our health lives, then it really makes sense that we need to integrate the religious leaders into getting immunization program to progress. I want to talk about three things in reaction to Sarah's presentation. One is the vaccine hesitancy around COVID, where our recent work in Nigeria is focusing on. And then the other one is on polio. And then the last one is on an important topic for immunization in the next decade, which is reaching the unreached, the zero-dose child. So in terms of the role of faith leaders in polio, for example, in Nigeria, it's very clear that, I think you mentioned it in one of your presentations. I think that's one of the most popular examples in the world where there was polio rejection, and what the immunization program did was to reach out to the Muslim religious leaders, because that rejection happened in northern Nigeria. They reached out to Muslim religious leaders and then started a long process of engagement and integrating them into the program. So Nigeria, for example, has what we call the Northern Traditional Leadership Council. That's headed by the Sultan of Sokoto. So like you said, there are some religions that are very hierarchical, and Islam is quite hierarchical, at least in Nigeria. So the Sultan of Sokoto sits at the peak of the hierarchy in terms of he's the religious leader for Islam in Nigeria. And that Northern Traditional Leadership Council has worked closely with the National Primary Healthcare Development Agency over several years in addressing hesitancy to polio vaccination and other vaccines as a whole. And I would say that relationship has actually paid off, because when COVID hit, and with all the conspiracy theories that has been circulating across the world and jumping from one country to the other, there was also conspiracy theories around COVID, and some of them with some religious inclinations to it. So the Nigerian government, the immunization program, was able to use that National Traditional Leadership Council, that channel that they had already established to dispel disinformation. So they were able to really engage the particularly Northern Muslim groups through that council. So in a way, that infrastructure was already in place. So what we are seeing, at least in our study, and I think another study, is that when it comes to COVID hesitancy, actually the Muslims are less hesitant than the Christians. That's what we're seeing in our study. And I spoke to somebody else, and I was wondering, why is this so? Everybody is seeing the conspiracy theories, the social media messages or disinformation or misinformation is equal opportunity exposure to both Muslims and Christians, why is it that you have more in Christians? So I believe that it's probably because we have already established a strong foundation through these NTLC. We have already established a strong connection with the Muslim religious leaders. And so it's easy to pass on information, it's easy, and we know they are trusted. So what we need to do is really establish that for Christian religion for the country. So that's my own opinion in this, because we've seen that it works with the Muslim faith. So let's also do the same thing with the Christian faith. So that's one thing with, you know, the contrast between polio and COVID. So whereas in polio, we found that Muslims were more hesitant, in COVID, we are finding that Christians are more hesitant. Now, the third point I want to make is around reach. So this is really about routine immunization as a whole, not just specific immunizations. It's really reaching the unreached. Every year we have, and this is really sad. Every year we have about 20 million children who have not received even one single dose of vaccination from the routine system. These are children we call the zero-dose children. And for the past 10 years, immunization coverage has not bulged beyond 1% increase. So we've been teetering, or we've plateaued. This is a global coverage of pentavalent 3. We've plateaued at about 85% for the past 10 years, in spite of, you know, all the gains that's been made. And what we found out is that it is actually those kids who you don't miss, who you miss, those communities you never get to. Those are the ones we need to really focus attention on if we are to make progress in the next 10 years. Recently, the WHO released the global immunization strategy for the next 10 years. It's called the IA 2030. And that strategy is really focusing particularly on reducing zero-dose. There's a target of reducing the zero-dose children by 50% in the next 10 years. And so thinking about it, how do you get to these zero-dose children? Who are they? They are in 4 critical areas. They are in remote rural areas. They are in areas where you have conflict. They are in urban poor environments. They're also in area where you have, you know, migratory communities that are not stable. But one thing you have in common with these communities or settings is that they are religious. They have religious leaders. If vaccines cannot get to those communities, religion is getting to those communities. So we need to see how we can work with religious leaders to bring both the vaccination program to these zero-dose children, as well as improve the demand and the uptake of vaccination for these communities. So in the next 10 years, I see this work actually being really important to shaping how we can, you know, really take advantage of the social and political influence of religious leaders for immunization, how we can take advantage of the networks and the reach, both organizational and physical infrastructure of religious organizations. I think, Mark, you were the one that mentioned that in Pakistan, some of the mosques have been turned into vaccination centers. So they have physical infrastructure that can serve the immunization program. And then how we can take advantage of the credibility that the religious leaders bring to their congregation for immunization. There's a lot of work to be done as we try to reach this, reduce the zero-dose children from 10 million today to about 5 million in 10 years' time. And I see a central role for religious organizations, religious leaders, but we need to understand how best to deliver this intervention and engage them. And there's some good examples, I would say, what Nigeria has done with Muslim religious leaders is quite a good example. So thank you very much.
No, thank you, Chizoba. That was absolutely fascinating. Listen, I have a slightly unfair question to you because I don't think any of us really have the required expertise, but it's a very topical one. This is from Nagula Nessia, who talks about vaccine hesitancy in Muslim countries being connected to Ramadan and the theology that a vaccination is a violation of the Ramadan fast. Has anybody looked at that? So clearly, we should wish Ramadan Kareem to all the Muslim participants today. But it's a very topical question this time of year.
It's very interesting, and one interesting thing is that I know that the Nigerian immunization program anticipated this, and they were ahead of the game. So they had messages. They had worked with imams and Muslim religious leaders, and then they had already prepared messages to show that you can still take vaccines even while you're fasting. So I'm aware that their risk communication and risk communication department have put out specific messaging around that. So if you understand where the hesitancy or the concerns are going to come from, you can, step ahead. You can, be in front of that concern with your messages, and then you pass it through the right channel. So the message and the messenger they are both critically important.
Thank you. That was a very helpful answer. In case anybody's not looking in the chat, Lauren Erickson Mamane has put up a series of links to material as part of the PEPFAR-funded Faith and Community Initiative, messages of hope around COVID-19 that are being adapted now to immunization. So those are very useful links. We have about 10 more minutes if anybody wants to add contributions and questions into that chat section on the website. I have a couple of questions for you. I was quite surprised to see this message that you found, Sarah, about people saying let nature take its course, or we already have a perfect immune system. I mean that if you're part of a group such as well, let's pick one, Christian Scientists, who have a particular theology about disease being illusory, or you're part of a group that thinks there should be no interference. That's reasonable, but it seems to undercut the whole basis of medicine, no?
Yes, I can't can't speak exactly to people's different religious interpretations, so it's hard to say, but I think sometimes that there can be contradictions, right, with anything in life. So there were a number of religions that had some kind of interesting theological aspects. I think one we know, or some people know quite prominently in Zimbabwe, is apostolic faiths, sort of in the Manicaland region, but of course apostolic faiths are in other areas, but it's just this sort of rejection of Western medicine for different reasons that really impacts the uptake of immunization. And there's been some really interesting work, though, when you probe through and you talk to people, amongst mothers in particular there, where they did, through outreach, they really do understand the importance of science, right? And actually they would like to have their children vaccinated, but through different kind of exploration and qualitative interviews, what they found was if the vaccinators came early in the morning and were unmarked, et cetera, they were willing to have their children vaccinated. So that's a great example of an entry point, right? So they weren't publicly seen, being vaccinated, but they were able to get this service done. Another example I think I mentioned earlier in the Jain faith, that, just sort of the killing of any microorganism is a problem. But using different interpretation, they're able to basically triage sort of the benefits of killing microorganisms, right? That a human would be sort of at the apex. So you can justify using vaccination as sort of the lesser of the evils. And you see that commonly throughout a number of religions, this sort of lesser of evils, right? It's permissible to save the life. Particularly two prominent themes were to save the life of women and children, but also to protect thy neighbor, which I really liked, right? The idea that you getting vaccinated, your family protects your community.
And especially those who are vulnerable and can't themselves be vaccinated or yeah. Moima Korka says, are there any, you mentioned, I think, Sarah, WhatsApp videos and the power of those. Are there any good ones available to combat vaccine hesitancy that can be easily found?
I would open this to my colleagues or others on the line. I personally am not aware of any, but I'm sure they exist.
Yeah.
Do any other?
Does know, please put them in the chat or put them
Chatbot.
into CCIH and they can be put into the resource center. Lauren Erickson Mamani also says another challenge we have is COVID-19 vaccination coverage prior to religious pilgrimages. So she quite rightly says there's an explosion in India right now tied to large religious gatherings. But by contrast, the Kingdom of Saudi Arabia is putting restrictions on Hajj participants and mandating vaccination, which I know Saudi Arabia has done for many years around meningitis and hepatitis. However, that's not happening in other places. So it's actually a very informative message there. But I suppose this idea of pilgrimages and using those as an opportunity to get people immunized, we know from the Hajj and from the Uman that it does work. I mean, Saudi Arabia has required it, and it does work, right?
Yeah, I think that's a great observation. Some others had mentioned sort of their fears at the time of the interviews about these upcoming kind of religious pilgrimages. And I think that would tie to sort of the larger observation that, you know, working within existing structures and processes is more likely to be successful. And clearly that could actually be, you know, a driver of spread. I think that's a great idea.
Chizoba, I mean, not vaccination, but we've seen lots of work in Africa, I think, around adapting traditional practices to make them HIV safe, right? So we've seen lots of religious leaders who've adapted traditional practices to reduce the chance of disease transmission. Have been really willing to do it, right?
Yeah, that's actually true, and we've seen some of that in immunization as well. I think Sarah mentioned the use of barbers, right, to encourage parents of newborns to vaccinate their kids. So in parts of northern Nigeria, if a kid is born, they have to have their head, a Muslim kid, they have to have their head shaved within I think by the 7th day or so. So that's a practice. I think it's traditional. Well, that's a traditional / religious practice that feeds into the timing of, you know, routine immunization for newborn kids. Another practice that has been tied to immunization is the naming ceremony. I was in Katsina State, went for supportive supervision, and we saw this imam he was just his own initiative, and he decided that before he would name a child, which is supposed to happen on the 7th day, the parents must come with the child's vaccination card. So they should have been able to get the BCG vaccine, BCG and OPV that's given at birth, and that really increased the immunization coverage, because we went and we saw that in this particular community, immunization had gone up by almost 40%. So we said, what's happening? And then they talked about what that particular imam was doing.
We're coming to the end, but we've had a flurry of final comments here, which are really interesting. Lauren again talks about vaccine hesitancy in the Hasidic community, and the ultra-Orthodox Jewish community is linked to the belief that herd immunity may already exist. Mona has put up a number of links that are useful. And then, yes, actually, the number of really useful YouTube resource links. So I suggest everybody have a look at that. And if you don't know how to do it, on the bottom right there are 3 dots that let you save the chat. So if you're worried about not having written down those links, you can click on those 3 dots, and one of the options there is save the chat. And I find that a really useful way, because I don't write fast enough. Um, so I think actually we're almost out of time, and what I should do, Chizoba and Sara, is thank you for a fascinating hour, which has gone too fast. I know we have people from lots of faith traditions in the audience, so if you're comfortable, I just ask you to join with us before we end, to join with me before we end in a moment of prayer. And the great privilege is we can all sit at our computers and at our phones and talk to the creator of the universe. And sometimes the creator even talks back. So let's spend a moment in prayer, if we may. Loving God, in the book of Deuteronomy, you're that mother eagle who lifts us into the air, who teaches us to fly, who catches us in your wings, in your mighty wings when we fall. And we ask today that you would put your wings under us, and you would lift us up as researchers, as scientists, as people working in vaccine manufacture and distribution, as healthcare professionals, as people working with families and with communities. You'd give us the words to speak, and you'd give us the work to do to build your kingdom. Loving God, yesterday, Mohammed Ali Pate, the director of health at the World Bank, said we were seeing tribalism break out, rich tribes in the world saying us first, people saying we'll take care of our own, and others can put up with the crumbs from the rich man's table. And we ask that in this pandemic time, in this difficult time, loving God, you would give us a voice to speak out against that, and to speak instead of your kingdom which is not only our shared hope, but our current reality, if we choose to live in it, where each is made in your image and loved and valued by you as much as one another. We ask all of these things, loving God, in the name of Jesus, the one we call Lord and Savior and friend. Amen.
Amen.
Thank you so much for joining us. I hope it's been interesting and useful, and we look forward to seeing you soon. Thank you.
Thank you.
Bye-bye.
Thank you.